Hello again, Tanya.
Hello.
So we've had our consultation with Louise and she's gone off home now. And now that it's just the two of us, I'm going to sit down and talk about how you did, so that we can review what went well, what went badly. It was obviously very important that I didn't do that with her here. This is between you and I. It doesn't have any impact on her as a patient. Before this, obviously, you gave me your form and I ticked off the things that I think have gone well, but really there are no areas that I don't think you did well enough in.
That's good to hear.
But what do you think went well?
Well, as I said to you at first, I was quite concerned about the correct technique and giving the right instructions, and she seemed to do it properly, so I guess that went well.
Yes, I think that did go well. What bit of it did you think went perhaps not quite as well as you would have liked?
Well, I just feel that, despite my kind of saying, do better, you can do better, she just wasn't improving. So I think there must have been something I could have done there to help her along.
The problem with peak flow is that it is effort dependent. And you were trying very well to encourage her to use more effort. And your positive comments that she'd done it well but needed to try harder worked well because she didn't look discouraged, which can happen. Because it's impossible not to portray that you can see that she's not quite getting it. And you acknowledged with her that she might need some practice. But one way of dealing with things is to use different forms of words to explain things. You tended to use the same language, and that's something that we do unless we've learned to think about it. What I sometimes find works is to use an analogy, so to describe what you're doing in terms of something else. So with peak flow, I often use a cake with an embarrassing number of candles, and you want to blow them out as fast as possible so someone can take the cake away and cut it and they don't have to count.
Okay.
It relaxes the patient and it gives them an idea that you want lots of effort in a way that isn't so straightforward, because some people find that works better for them.
Okay, that sounds good.
One of the skills with experience is using different language for different patients. But that is something that will come with experience. So I think the things that went well were your use of positive comments and beautifully clear instructions. It wasn't difficult to follow and you took them through step by step. That worked very well. The area for development is just to become more confident and more used to using different language for different patients. And perhaps the answer for that is for you to go away and practice with some different patients. Both this and maybe some other practical technique that patients have to learn. And perhaps we can find you some patients on the acute medical unit who come from different backgrounds where you might need to explain things in a different way to practice that technique.
That would be really good, really useful. Good.
So we've agreed that on what we think went well. We've agreed there are some areas for improvement and you're happy with what those are. Your explanation was fine and you dealt quite nicely with why it wasn't quite normal. You needed to sound a little bit more confident, but I think perhaps, do you think you need to do a little bit more reading about how asthma fits in with peak flows?
I wasn't prepared for the question at all and I was quite taken aback when she said it, so it was all very much off the top of my head.
Yeah.
But I think I really ought to stop and think about the kind of questions patients would ask and what the ideal answers for them would be.
Absolutely, and you've thought of that. So your 2 action points are to go and practice explaining different things to different people so that you learn about different language, and to think about the questions a patient may ask you about a procedure before you explain the procedure to the patient.
Okay.
I think those are 2 simple things that you can go away and work on and hopefully do procedures better in the future. But you're doing fine, this is about improvement.
Brilliant, that's really, really good to know. It reassures me, and hopefully next time I will be more confident knowing that I am giving the right instructions.
Great. Thank you very much.
Thank you.
Best of luck.